Hi, my name is Gabrielle Rapkin and I attend Southern Technical College. I'm here to present a speech in an attempt to stop this seemingly never-ending pandemic in which we're living. The early months of 2020 were uncertain. A new virus took over the world and shut majority of activities down. The mask situation in the beginning was also uncertain, but if we take a look back in the past of respiratory-type viruses, it has shown that masks are generally effective in preventing the transmission or the spread. For my speech, I'm going to discuss mask regulations for the pandemic SARS-2 COVID-2019 in which we're all experiencing now. I'm qualified to speak on this topic because just as any of us in this room, we are witnessing and living through it. I have been researching the coronavirus 2019 strain since it began multiplying in Wuhan, China before America was shut down in March of 2020. You should know about this topic because we need to work together to end the pandemic. At the end of my speech, I want you to agree that masks are a useful tool in preventing the spread of disease. The main points I will focus on are that masks have been used for over 100 years, even before we knew about germ theory and preventing respiratory transmission viruses. Although the vaccine is being administered, masks are still very important to kick the virus because you can carry the virus and show no signs of it yourself. And research shows that any type of general mask use is likely to decrease viral exposure and infection rate on a whole population level, despite imperfect fit and imperfect adherence. Research during previous widespread illness has shown masks as an effective personal protective equipment. According to the CDC, respiratory protection in the form of something that covers your nose and your mouth has existed since 50 ADE. The Spanish flu pandemic of 1918 through 1920 killed 50 million people, which can be contributed to the lack of respiratory protection and hygiene practices of the era. Current research for the COVID-19 pandemic shows that properly wearing a snug-fitting mask over your nose and mouth with hand hygiene and social distancing reduces the spread of the virus. Currently, 2 million people have lost their lives with COVID as the reason on the death certificate. Though research suggests current vaccines have a 54 to 96% effectiveness, depending on which vaccine and how many boosters you received, only a fraction of the population is being vaccinated due to production rate being slow, and many people cannot be vaccinated due to medical problems. Our emphasis on mask use is important because majority of Americans do not want to give up their freedoms by going to restaurants or going out, for example, to bars, movies, malls, or stores. The production rate of vaccines is not nearly fast enough for the amount of people who want the vaccines, so in the meantime, mask wearing and social distancing are the next options available. It's important to note that there are criteria for getting a COVID vaccine, and the request has to be approved by your physician. Research also shows that a person can carry a virus without showing symptoms, and by getting a vaccine, you are less likely to show COVID symptoms if you get infected. But you can still pass the virus to someone else and get them very sick. And some people can't get a vaccine due to medical conditions, allergies, or even a compromised immune system. Given the importance on stopping the pandemic, sometime in the near future, we all need to play a part. The easiest and most convenient thing for us to do is wear a mask. And in the case of an airline exposure, January of 2020, a man was traveling from China to Canada, and once he arrived, he tested positive for COVID-19. There was 250 people on that plane, and nobody else caught COVID, which is thought to be mitigated by mask use. Research shows that public mask wearing is most effective at stopping the spread when the compliance is high. A study done in August of 2020 shows data collected from April and May of 2020 when there was a U.S. government mandating mask use. The research estimated that COVID-19 cases were dropped up to 2 percentage points per day, cautiously suggesting that the mandate had averted as many as 450,000 cases of COVID after accounting for other mitigation measures such as physical distancing. Now that I have shared my argument, let's go back over the main points. First, I went over how masks have been used since caveman days to prevent things from going into the nose or mouth. Then I considered that there are new vaccines and the necessity to still wear masks to prevent the transmission of COVID due to being a silent spreader. And finally, I discussed an example of how COVID was stopped dead in its tracks thanks to masks. Given these points, I want you to agree that masks can be a useful tool to prevent spreading COVID further. Although we really should be doing more, such as staying home as much as possible, we have to consider the reality of life and we all need an income to survive. Thank you for listening to my speech, and I hope you wear your masks.
Cool beans.